for a week for meeting with members of the European Parliament and members of the different commissions. Again, advocating for the stop of the genocide in Gaza, advocating for more pressure coming from the European Union and European countries on Israel to change course and to stop the attack. So we thought, on top of speaking to politicians and all these higher up officials, that we want this opportunity to speak also with the community. So we thought UVA would be a very good opportunity for us to speak with a very strong and political-oriented university and community. So thank you for that. So I'm Guy, as Irela said, and Physicians for Human Rights Israel. We are an organization that is registered in Israel, based in Israel. We were founded 35 years ago by Ruchama Merton, a psychiatrist, together with other doctors who wanted to make the connections, the solidarity between Jewish Israeli doctors, Palestinian doctors, and Palestinians in the West Bank and Gaza. Actually, the organization was founded in Gaza anyway, in a visit to a Shifa hospital. We will talk about it very soon, when the doctors went there to see what are the conditions. I was only 6-year-old. I was not. I didn't have anything to do with that. So they went there to see. It was the first Intifada, to see what are the health conditions in Gaza. Of course, they were appalled, and then that kind of started the organization. Today we are a bigger organization than back then. We deal with asylum seekers and refugees living in Israel, with Palestinian living in the occupied territory, of course, with detainees and prisoners in Israeli incarceration facilities, and also we're dealing with inequalities within Israeli society, and we do all that in the kind of framework of advocating for the right to health of everyone between the river and the sea, arguing that this is the most maybe basic human rights and this needs to be protected, and political structures need to be changed in order for that right to be achieved. In today's talk, I'm gonna. I apologize already because it's kind of a depressing topic. Of course, I'm sure none of you came here thinking that's going to be a happy topic to talk about. But I gave this lecture yesterday, and even I was surprised how much of a depressing to look at all these kind of different developments in the past year and a half. Looking at all this together, it is even harder. So, if for someone it's difficult, I didn't use any kind of problematic pictures that is very difficult to see. But if someone, of course, needs to go out or anything, I will totally understand. And we'll talk about. We'll start with talking about Gaza's healthcare system before October 7. As we all know, many people like to start history from October 7. But also, when we talk about the attack on healthcare, we need to understand what is exactly the healthcare system in Gaza, what it was before this massive attack that we've been seeing in the past year and a half. And then we'll address the systematic and intentional attack on medical infrastructure, the detention of Palestinian medical workers, the obstruction of medical evacuations, the complicity of Israel's medical community, kind of looking inside into Israeli society, and then kind of trying to think what will be the day after. Hopefully we'll get there. So this is the cover of a report published by the UN in 2012. On the cover, it's phrased as a question, but the report has it with an exclamation mark, claiming Gaza will not be livable by 2020. Another report by the UN that was published in 2018 kind of repeated the same result, arguing that Gaza will not be livable by 2020. I'll address some of the reasons why health in Gaza was at risk for many years. But of course, back then, I don't think anyone could imagine how much unlivable Gaza will become. And of course, we all know now it's definitely not a place that you could argue is livable. And the Palestinian healthcare system was constructed in a way that is supposed to be unitary. As of course many of you know, the geography, Israel-Palestine is very small, so the travel between Hebron to Gaza, to Ramallah, to Jenin, it's just a few hours in any direction. And the idea was that if you have one treatment available in Gaza, you don't have to repeat that and have that also in a hospital in Nablus, for example. So the whole system was, as much as you can think of this system under occupation as something that's planned, the idea was that this is one system for the Palestinian people. And of course, when Gaza was cut off from the rest of the Palestinian territory, that had very bad implications on health. In Gaza, there were only 3,000 hospital beds, which is half of what the minimum requirement that WHO defines, that is a minimum requirement for a healthcare system to be operative. Numbers of doctors and nurses and midwives per 1,000 people, also less than half of what the minimum requires. The medicine that was available, that kind of course fluctuated, but there were times where 50% of the medications were not available, at zero stock, and they're depleted, of course, of medical equipment and consumables. And a lot of the specialized treatments were not available, again, because of this cut of Gaza from the rest of the West Bank. I'm going to talk a little bit about that later. And looking into the actual attack on healthcare in Gaza. So, of course, we need to go back to the 1948 Nakba, and until now, the occupation of 67, the blockade that Israel has imposed on Gaza since 2007. I'm running kind of quick because I assume this audience have this kind of the basic context, but if there are any questions, I can explain. And more recently, 5 military attacks on Gaza between 2008 and 2021. In each of these attacks, mass destruction, a lot of injuries, destruction of medical facilities and other infrastructure that's important to health. Any kind of this, each of these attacks kind of deteriorated the way that the healthcare system in Gaza could provide for the Gazan people. Most notable is the Great March of Return between 2018 and 2019, demonstrations on the Gaza border, where almost 36,000 people were injured during these demonstrations, 2% of the population of Gaza. So the healthcare system, with its very diminished capabilities, had to also attend to so many injuries. A lot of them resulted in amputations and very complicated orthopedic and other surgery. But still, with all that in mind, the Gazan healthcare system was really the backbone of the Gazan society. It was a public system of the people, for the people. Every family had a doctor, a nurse, someone working in this system. People had trust in this system, and we were, in our capacity, we were in very close connection with the medical system. We are still with the medical system in Gaza. Between 2009 and 2023, we dispatched more than 100 delegations into Gaza. Each delegation, approximately 30 doctors and mental health workers, mainly focusing on capacity building, surgeries, teaching, training, because doctors from Gaza or mental health professionals could not go out to do training, fellowships, everything that's so important for the medical professions. So we saw that kind of very in real time. We saw how the people of Gaza have trust in the system, in the people that care for them. Unfortunately, because I'm Jewish Israeli, I could never enter Gaza as part of these delegations because of Israeli restrictions. But every time our volunteers and our staff member came out of a delegation, they were always kind of speaking about how professional and how capable are the doctors that they are meeting on the other side. That only just a few visits and training, they get the kind of they become professional as much as the professionals that are really trained for that in years back in Israel. Just one example, there was no capacity to do kidney transplant from a live donor in Gaza. So for many years, the list of people waiting for a kidney transplant was getting longer and longer. There was one Jordanian doctor and one British doctor that came once every few months to do like just 2 transplants and go back. And then we had this project of 12 visits of the best experts in Israel, Palestinian doctors, of course, coming into Gaza, training local personnel to do these transplants. The last visit of this project was scheduled for October 12, 2023. That delegation, of course, didn't leave, and we're even unsure what was left of the equipment of the people who were trained. So, of course, everything was lost, like many other things. And as I said, because of the limited capacity of the healthcare system in Gaza, especially some treatments that were not available because of equipment, but also because of limitations of the Israeli military. For example, a lot of cancer treatments were not available in Gaza, and then people had to use this elaborated permit regime in order to get out of Gaza, to get the treatments mostly in East Jerusalem. We actually have here an expert on the permit regime, Dr. Gilad Dayan. And there's sometimes this idea that a lot of these treatments were in Israel. Israel was sometimes using it for like publications and kind of showing how it's human caring for Gazans, but only 4% of permits and treatments were in Israel. All the others in the West Bank and East Jerusalem, and mostly in East Jerusalem. And I'll get back to that also later. This permit regime was just cruel. People had to apply again and again to get the permits. Permits were rejected, denied, delayed, and a lot of patients had to miss treatments. And as you can assume, a cancer patient that have like a regime of treatments and then they have to miss treatments, it also it caused death, unfortunately, and deterioration in their health condition. Third of the applications that were made by minors was rejected or delayed. Third of the parents requesting permits to live together with their kids for medical treatment were also rejected or delayed. It caused, like I said, in death, in separation of families. Unfortunately, we had cases of a 4-year-old hospitalized for months in an East Jerusalem hospital without a parent at all next to them. Just imagining a 4-year-old going through the most painful treatments, cancer treatments, without the parent next to them. So some of the kids had to live with their grandmother, or sometimes even an aunt or even a neighbor, because the parents couldn't get a permit. As I said, missing treatment, but also extortion. So these permits was also used by the Israeli security forces in order to extort and really get Palestinians to collaborate with the Israeli security apparatus. And then October 7 happened, and the massive attack on Gaza started. Sometimes Israel kind of tells this story of that the Israeli military had to attack Gaza, but then the Hamas fighters were shooting off hospitals or shooting missiles off hospitals, so they had to react and attack hospitals. This narrative is really something that has no relation to what happened on the ground. And part of that is we can see 6 days after October 7 already, Israel issued evacuation orders to 22 hospitals in North Gaza. So all the hospitals in North Gaza got an evacuation order. As you can assume, they could, of course, not evacuate these hospitals. There were no ambulances in the numbers to evacuate 22 hospitals, no roads that are safe, because Israel was bombing very aggressively those days from the air. No doctors to escort these evacuations. It was just absurd. And the fact that these general evacuation orders show that this is a campaign, this is a concentrated, structural attack on the Gazan healthcare system. And that didn't start in October 13. Actually, as early as 2009, already Israel started kind of with the claim that Shifa Hospital is actually a command center for Hamas. So for 14 years before the actual attack on the Shifa Hospital that I'll get to later, it was already branded as not really a hospital, but a command center for Hamas. We'll later talk about what evidence we have of that, and there's none. One of the example of the evacuation orders is the evacuation order that got Al-Quds Hospital in October 29th. Actually, Al-Quds, of course, got the evacuation order already in October 22nd, but they didn't evacuate, they couldn't. And then in October 29th, it was a Friday night, they got a phone call from the military. The director got a phone call, and the military told them, if you're not evacuating the hospital, we're going to attack the hospital. he called us really stressed. What can we do? I cannot evacuate the hospital. They're going to attack us. So we appealed to the High Court in Israel. We submitted a petition, an urgent petition, to stop the attack on the Al-Quds hospital. It was a Friday night, almost midnight. It was all of these days in October, of course. So it's like a whole mash in my mind, but I definitely remember that nightmarish night where we were absolutely sure they're going to just attack a hospital and kill patients and staff members. We couldn't even imagine that, and we couldn't even imagine that months later all hospitals will be attacked, all hospitals will be raided, hundreds of patients and doctors will be killed. And the court ruled a petition was submitted demanding to limit the Israel Defense Forces' freedom of action amid its effort to protect the citizens of Israel. War-related court petitions are categorically dismissed to prevent the overburdening of the government branches and the need to address such petitions while our enemies hunt us in the north and the south. So these are the judges. It may sound like Smotrich or someone like a minister from the right, from the extreme right, but these are the High Court judges, basically not only rejecting our petition, but also adding a kind of reprimandment that we even bother the system in this time of war. That was actually important because the right wing got that kind of message from the High Court and, of course, started attacking us for aiding the enemy in the time of war. At that night, the hospital was not attacked, but less than 2 weeks afterwards, Al-Quds basically ceased operations. This is, you may remember, some of you, so the Israeli spokesperson of the military spokesperson had these kind of illustrations of this is Shifa hospitals and all these different rooms and tunnel system under the hospital. And there's a very good reason why, we don't need that. There's a very good reason why the Israeli military issued this specific argument, because according to international humanitarian law, medical institutions and facilities are protected. In order for them to lose the protection, the enemy needs to prove, to have evidence that these hospitals were used to attack its own military. So it's not enough that there are Hamas fighters in a hospital or hostages held in a hospital or different arguments that Israel provided as well. But it is important to show that it is a command center, because then they can argue that the hospital loses its protection. None of that, of course, was backed by evidence. When the spokesperson showed this absurd video, the Hebrew-speaking of us can go back to this video and see how absurd it sounds right now. This is just the late October. But he kept saying 3 or 4 times, he repeated the argument that I'm only showing you illustrations because I cannot show you the real evidence, but we have the real evidence. So he said that 3 or 4 times. We have the real evidence that there's a command center under Shifa Hospital. Since then, I'll talk about it a bit later, Israel raided the hospital, had full control over Shifa, all the premises. Definitely, if you see kind of the illustration that the military published, there's supposed to be command centers in all these different buildings. No evidence of that. Israel had control over the entire premises. It could get international forces to see to make sure that the evidence is objective. None of that happened. They did get 2 international journalists to see and document a tunnel that was under Shifa Hospital, one tunnel with 2 by 2 rooms under the hospital. Of course, the gap between that evidence and the claims are very big. And then we see the attack on the Gazan healthcare system. So one aspect of the attack is the attack on infrastructure. Already by November 12, 1 month after the attack started, there were already 137 attacks on healthcare facilities, diminishing the number of beds in Gaza that were already very low at 3,000 to 1,400 hospital beds. So very, very soon, basically the healthcare system could not provide the minimum care for a society that is under such a violent attack with so many wounded and injured individuals. And until now, 565 attacks with more than 900 people who died in these attacks inside hospitals. The destruction of 94% of Gaza's healthcare facilities, either damaged or totally destroyed. The Turkish hospital totally razed to the ground with bulldozers. The burning of hospitals such as we saw in Kamal Adwan and El Shifa. I'll also get to that a bit later. And the destruction of wash facilities, which is water, sanitation, and hygiene. That is also a very important aspect of maintaining safety and health in a population of 2 million people, more than 2 million people. Just this Tuesday, attacks on two hospitals, the European Hospital and Nasser Hospital, both in Khan Younis, with dozens of people dead. Again, an Israeli claimed that there was a bunker under the hospital, but I'm not sure if you're following, but then it was proved that they showed that the picture of the alleged tunnel that was supposed to be under the European Hospital was actually in a building next to the hospital, not in the hospital, but still the hospital was attacked. We heard today from the WHO that while the European hospital was attacked, all the patients that were collected from the entire Gaza Strip and WHO staff members were in the European hospital waiting for evacuation. And they contacted the Israeli authorities telling them, we have here all the patients that need to be evacuated, don't bomb the hospital. And they bombed the hospital. Fortunately, none of them were harmed. Others were, of course. The other aspect of the attack on the Gazan healthcare system is the killing and injuring of medical personnel, with more than 1,400 healthcare workers were killed in the past year and a half. The maybe most kind of visible case was the execution of 15 Palestinian medics and emergency responders like a month and a half ago. Where it included 8 members of the Palestinian Red Crescent Society, 5 defense personnel, and an UNRWA staff member. As you may remember, Israel originally claimed that they were not marked as healthcare professionals. Then there was a video that surfaced that clearly showed that they were marked. And then as we know from previous cases, for example, with Shirin Abu Akleh, there's a version that Israel publishes, then there's evidence coming out, then they change the version, then there's another evidence, more evidence coming out, and then we see eventually that what we've seen is just the execution of 15 paramedics marked as paramedics and health workers and buried in a mass grave. The other aspect of attacking healthcare, the Gaza healthcare system, is the raiding of hospitals. So one example is the Shifa hospital that was raided twice. The first time in November 2023, first bombing, siege of the hospital, and then the raid. At the time, there were 700 patients at the hospital, and you may remember the story around the 37 premature babies in incubators that were at the hospital at the time. It was very kind of painful for us to deal with that. At the time, it was already more than 10,000 people that were killed in Gaza, half of them children. And then we suddenly saw all the world kind of, there are 37 premature babies, which of course is very sad, 37 premature babies. But our Palestinians need to be prematurely born babies in order for anyone to care for them. But there was an outcry, and eventually the WHO was able to evacuate 34 of them. 3 of them died, unfortunately. They were all evacuated to Egypt. 1,500 staff members, 7,000 IDPs that took shelter in the hospital. That was the first time. The second time, that was even more aggressive, in March 2024. Already not the great Shifa hospital that it was before. Only 220 patients were left in this kind of very limitedly operated hospital. Among them, Rafif and Rafiq, Durmush, 2 kids, 2 brother and sister, 14 and 16-year-old. I'll tell the story in a second. So all the patients and staff members were taken to one building, the knife building that is inside the compound. Their companions were kicked out of the hospital, so they were left with no family members to support them, only the staff. And then the attack that took place for 2 weeks, the Israeli military was basically occupying the hospital. It is important also in terms of international law, because the law of occupation also applies for like limited times of occupation. So the 2 weeks that the Israeli military was occupying the Al-Shifa hospital, the laws of your occupation apply for these 2 weeks only for that compound. So even if there are different Israel, they have like a very elaborated legal kind of departments to show that they're following international law, but and saying that Gaza is not occupied, or all these different arguments, but there is no question that these 2 weeks the hospital was occupied, and that means that the Israeli military had obligations toward the people, the 220 people that were and locked in this building. They were supposed to protect their safety. They were supposed to provide food, water, medication, everything. None of that happened. Among the patients were, like I said, the 2 kids, Rafif and Rafik. Rafif, the girl, she had her foot amputated. Rafik had his leg amputated underneath the knee. Because of a bombing they suffered 2 weeks before the raid, so they were hospitalized in Shifa. They lost their mother and one of their siblings, and they were in dire need of medical attention. They didn't have in the building. They were kind of locked in. They didn't have food. They didn't have bandages to replace for their wounds. We were trying together with two international organizations and one really an amazing diplomat that was just doing that. Like, if her supervisor would know that she's doing that, she would probably be fired. But we were really trying together, the 4 of us. We had this WhatsApp group, like where we tried to get the evacuation of these 2 kids every day. So these were, I think, very difficult moments in this past year and a half. But these were the most horrible 2 weeks I personally had. Every day we were trying to get the evacuation of these kids, and every day the military blocked it. So they would tell us, okay, tomorrow morning at 11 we'll allow the evacuation, and then we'll do all the preparations to get the ambulances from the WHO, from PCRF, everything, and then no, there's no evacuation. And then again, maybe this evening. So like for 2 weeks we were trying to get these 2 kids out, and we couldn't. We sent a letter to the military kind of demanding that they provide food, medications, everything to the people locked in the building. And we got this response that was very elaborated. We are providing this and that amount of food. We are providing this and that amount of medications. We are in touch. We checked, and Rafif and Rafik are okay. And we are creating this field hospital inside Shifa where we can care for the patients and care for Rafif and Rafik. I personally don't believe a word that the military says, but it was so specific, and they were saying they were going to do all these things. I believe that they are actually going to do that. They didn't do any of that. They took Rafik from the entire group of patients. They told the doctors there that they are evacuating him, but what they've done is they put him in one room away from all the other people. For 5 days he was locked in that room with no food and no medical care. Only they found him later. When the military got out of the hospital and they found that he was there, they thought he was evacuated. We were in communication with a doctor in there who told us it's okay, they evacuated Rafik. They were sure he's evacuated. And then 21 of the patients died. The hospital was rendered non-functional. As you can see in this picture, the kind of the pride of the Gazan healthcare system, that's the way that it was left after the military left. Another kind of important aspect of the destruction of the healthcare system is the destruction of hospitals, but also when it is part of a tactic of ethnic cleansing. In October 2024, the Israeli military started the attack on the north side of Gaza, starting to depopulate the area very massively. And immediately when this operation started in October 2024, attacks on Kamal Adwan hospital started. Kamal Adwan was the only really hospital functioning in the north side. There's also the Indonesian and Al Auda hospitals. But Al Auda is very small, and the Indonesian was hit so many times they were not really operative. but Kamal Adwan was still operative. And the director of the hospital, Dr. Hussam Abu Safia, was very vocal. People followed him on Instagram, seeing the kind of the results of these 50 attacks on the hospital. But the hospital could still be there for the people that needed the care. Only 10 of the WHO missions were actually successful in providing fuel and medical supplies. And a lot of the patients were already evacuated gradually from Kamal Adwan to a Shifa. And as the attacks became kind of more and more aggressive on the hospital, we tried to address the different institutions in Israel to stop this attack. If you can see, we sent a letter in November 25th, and then another letter in December 8th. We didn't get any responses, and then we submitted the petition to the High Court on December 24th. It's then December 25 that we got the response for all the letters we've sent before, only once the petition was submitted. And the military response was, IDF personnel have been in continuous contact with hospital staff throughout the operational activity in the area in order to receive updates regarding emerging humanitarian needs, and have acted to enable and coordinate the delivery of supplies to the hospital, including food, water, medical equipment, and fuel, for the operation of the hospital's essential system and to maintain its functional continuity. This was done despite difficulty of doing so during the intense fighting taking place in the area. So this is a letter response that we got from COGAT, the unit in the military that is responsible for cooperation in a kind of communication between the military and international organizations, humanitarian organizations, and everything that is civil related in Gaza. It is actually important to say that, because Mais and I, when we're now meeting with a lot of officials in the EU, they are saying, we are talking to COGAT all the time, they are very receptive, they are listening to what we are asking, and we were like, no, this is like a really an absurd facade. The military even calls the COGAT kind of the humanitarian branch of the military. Of course, this should never be accepted as such. And as you can see here, this is the response we got from COGAT. 2 days later, the hospital is raided. Immediately when the raid started, we again submitted a request to the High Court for an urgent hearing. It was denied. We got this response. No, everything is okay. We don't have to do this urgent hearing. And the hospital was raided, became non-operational, burned in some of the parts, and 240 people from the hospital were forcibly disappeared. From them, 44 healthcare workers. One of them is Dr. Hussam Abu Safia, the director. And then the 75,000 residents that were left in North Gaza were left with no operational hospital to care for them. Also, one thing I didn't mention is that there is almost, also before October 7th, there's almost community healthcare in Gaza. There was never, it wasn't something that was created properly. So the hospitals were not only performing for like urgent cases or emergencies, that was the only kind of medical institutions available for also in the community. And so the minute there were no more hospitals in the north side of Gaza, the result is that the residents that were left there were left with no medical care. And we've seen people leaving, of course, in greater numbers after that happened. And we know that from history, we know that from Syria, where when the enemy that attacks an area wants to ethnically cleanse it, they want to depopulate the area, they attack healthcare, and then people have to leave. Eventually, people can get somehow food, can get somehow water. But if I have a family member that needs medical care and there is no hospital available, I'm going to take my family and leave. And that works. It's very effective. So that was definitely a tactic of depopulating the area. And as I mentioned, the forcibly disappearing of so many healthcare workers for Kamal Adwan. This is part of a campaign of detention of medical personnel in the healthcare system in Gaza. So, like I said, the attack on infrastructures, raid, killing and injuring of doctors, and the detention of more than 300 doctors since the attack started. There were kind of very big kind of detention operations, one in Shifa in the first raid in November 2023, and then in March 2024, the raids of El Auda, Kamal Adwan, Nasser, El Shifa, and again Kamal Adwan in the end of 2024. Like I said, total over 300 healthcare workers that were detained. The legal apparatus within that they were used to detain these people is a law that Israel applied, that is the unlawful combatants law. So these doctors and medical workers were deemed unlawful combatants, which means basically they have no rights. So they're not prisoners of war that have some protections, and they're not prisoners that also have some protections. It's administrative detention with no protection, and with, for example, when the law was first applied, they could hold them for 180 days without seeing a lawyer. So it's 6 months without a lawyer, and of course, I'll also mention that. There's no oversight over these detention facilities. The ICRC is not getting access to them. So without seeing a lawyer, no one knows where they are, what their condition is, if they need something. And they're just in this black hole of the torture camps of the Israeli military. And just an anecdote of how absurd it is. At one point, we got a family that contacted us asking where their grandmother is. They couldn't find their grandmother. The military raided the area in Gaza where she was. They couldn't find her. They thought maybe she's dead. Maybe they took her. We kind of applied to the military apparatus that kind of provides information on detainees. And we found that she was detained as an unlawful combatant. She was an 82-year-old Alzheimer patient. She was hardly able to speak. For 2 months, she was held as an unlawful combatant. And she needed really very important kind of urgent medical care. She didn't get that. And then she was released. But that just shows how this blanket definition was used with no even rationale. One of the more famous cases is the arrest of Dr. Muhammad Abu Salmiya, the director of a Shifa hospital, who was detained in November 2023. And as I mentioned before, so for 14 years they're saying that Shifa is not really a hospital; it's a command center. So of course the director of a Shifa hospital is not a terrorist, it's an archi-terrorist. So they detained him, held him for 6-7 months. And then just released him, because they had no evidence to keep holding him, and at the time they were releasing a lot of detainees because they didn't have any more places in facilities. And if you see that this is one of the media coverage of the release of Dr. Abu Salmiya, that became really an outrage, especially in the right wing. How come you released this terrorist? You said he's a terrorist. You said he's the director of a Shifa hospital. How come he's just released back to Gaza? And there was an outcry about that, and that is important because after that, no one was released. So hardly any doctors were released after the release of Dr. Abu Salmiya. And it needs to be understood also in this context of the campaign against the system. So doctors, by being doctors or healthcare workers, are already marked as terrorists. Today, still 150 doctors and medical personnel are held in Israeli facilities, and the meaning is that these 150 doctors are not in Gaza, and where so many doctors were killed, so many doctors were detained, and the doctors that are operating in Gaza are totally traumatized and burnt out. These 150 doctors are very important. It's very important for them to be there, to be with the people. Sometimes we hear of kind of these delegations of 10 doctors coming from Canada, 15 doctors coming from Europe. Then they come for 1 week, 2 weeks. There are 150 doctors that are the best in their profession. They know the people, they know the needs. These are the people that need to be in the hospitals in Gaza right now, and they are held in Israeli facilities with no charge. This is a link to our report that we published a few weeks ago, in which we visited 33 medical workers incarcerated in Israeli facilities and collected the testimonies of how they were detained, how they're being held, the interrogations that they are going through. And what we've seen in these testimonies is that the interrogations are not even implying that they are part of any kind of military action or militant action in Gaza. They're trying to get from them information and intelligence on where Hamas people are, where hostages are, and that is contrary to international humanitarian law. They're protected. You cannot detain them for information or intelligence. If there is some suspicion that a doctor or someone was part of a criminal action or militant action, then it makes sense that you can maybe detain that person. But they don't even claim that this is the case. The testimonies include stories, horrifying stories of physical, psychological, sexual violence, forced confessions. Of course, the detention is totally arbitrary. No legal representations. They tell in the testimony about the extension of the detention. So every 3 months they need to be extended, and then they just handed a phone. Here's the judge. Talk to the judge. They talk to the judge. They don't even know if it's a judge or someone else, and the detention is extended. No lawyer present in some of the cases. Medical deprivation, denial of contact with families, of course. And because the ICRC is not getting access, we really have very limited kind of ways of knowing and saving those people and claiming and arguing for their rights. The result, of course, is that they are dying. 72 actually detainees, at least 72 detainees already died in the past year and a half. Just as a comparison, in Guantanamo, 9 people died in 21 years. Here, there are more than 70 people who died in a few months. Out of them, 4 are healthcare workers, 3 doctors and a paramedic. One of them is the leading surgeon and orthopedist in Gaza, Dr. Adnan El-Bursh, who was also killed in the detention. One of the doctors we talked to is Dr. Khaled Al-Sir. He was one of the 2 that were released. All the others are still in detention. He was arrested. He was detained during this raid of Nasser Hospital in March 2024, and we collected a testimony from him in July 2024. The testimony includes we're really strict about what the information we want from them. We wanted them to tell us everything, how they were detained, hour to hour, what happened to them, to which facilities they were taken, what happened in interrogations. So we get these testimonies, and then we hear these stories again and again. So they were stripped naked. They took them naked and then left them to sit naked for 2 hours. Then they started taking them to different apartments in the vicinity of the hospital to interrogate them. Dr. Asir was sent twice back inside the hospital together with soldiers to show them the surgical department, to show them where the generator is. And then he was taken to Sde Iman, the notorious Sde Iman facility, where he described torture, starvation, being just cold during the night with no clothes, being 24 hours cuffed in hands and legs. Unfortunately, we also published the testimonies, so you can also, if you want, to read the testimonies. So these repeat themselves again and again. This is what practically all of them tell us, being detained from the hospital and then going through this torture in Sde Iman and other military camps. A part of this testimony reads, the soldiers handcuffed our hands behind our backs and shackled our legs too tightly. They threw the 3 of us into a military jeep and drove us around for over 2 hours. During the ride, they humiliated and beat us, sitting on us, kicking us with their boots and striking us with their rifle butts. We begged them to stop, but they continued. So he was released I forgot to add that. He was released in October, so he was held for 7 months in detention in Israel with all the torture that he described. 3 days after he was released, he was already at Nasser Hospital working as a doctor. That shows how much of a need it is and how much of kind of dedication we can see from Gazan doctors in the past year and a half. This is one of the interviews that he gave to Democracy Now!, but I felt bad for him in one moment because we tried to get him as many interviews in all kind of international media outlets in order to get the others freed. So he would work in the hospital, go out, do an interview, go back, and that's only like days after he was released, and kind of telling again and again the trauma that he experienced, but he was really, he still is very dedicated and willing to do that for his colleagues in order to get the story out. And so what we see this concentrated structural attack on healthcare. We see the attack on infrastructure, the killing, the detention, and then we have many people, patients in Gaza who have no available treatment for their needs. So we have over 25,000 patients requiring urgent treatment. This is a link to a position paper we published together with other organizations. And since there was some sort of mechanism of evacuation until May 2024, when Israel occupied Rafah. So until then, between October 2023, definitely not in the first few months, but later on we could get some people out. So 5,000 people left until Israel occupied Rafah. And since then, from May 2024 until January 2025, the exact number is 411 patients were allowed to be evacuated. So out of the thousands and thousands of people who needed urgent care and that was not available in Gaza, only 400 people left in this time of 7 months. When we saw that the occupation of Rafah is blocking any kind of evacuation, we petitioned the High Court. We submitted it in June 2024, and only more than 4 months later, the court instructs the military to publish some mechanism of how they're allowing people to go out to get treatment. Then it took 2 months more until the mechanism was published, which was basically a bullshit document with no timeline, no criteria, nothing. So it just was the continuation of the same process that they were doing, which was very bad because only 400 people left for so long. Then ceasefire, and the court erased our petition. There's no need. There's a ceasefire. I don't have much time.
3 minutes.
Okay. Yeah, I'm going to do that. And just I think the number doesn't reflect really the death rate, because we know that 125 patients died out of the number of the patients that were lucky enough to be on the list, have a hospital bed waiting for them in a third country. So 5% of them died just waiting for the evacuation. So it doesn't even include, of course, all the thousands that were not on the list, didn't get a hospital bed waiting for them. And what we are arguing for and pressing, and this was one of our main asks also now in Brussels, was to reopen this kind of humanitarian corridor to East Jerusalem. There are 6 hospitals in East Jerusalem, very capable. Before October 7, 30% of the patients of Augusta Victoria Hospital in Jerusalem, for example, were Gazans. So they have a lot of experience caring for these people, and that's the only way to get a mass amount of people who need immediate care out. Also, without kind of assisting the transfer of Palestinians away from Palestine. They stay in Palestine, they go to Jerusalem, they can go with their family members, hopefully not too far to a third country, to a place that already knows them, speaks their language, can adjust the care to the care that is appropriate for people who are coming back to Gaza. So many reasons why this is the right thing to do, but we can't get Israel to allow that. So we're trying to exert as much pressure to do that. One of the patients that we could get out is Sadil, a 9-month-old breastfed baby. Because of the closure of Rafah, she couldn't get out. It was very urgent to get her out because of a life-threatening disease. And after urgent intervention, together with an organization, the British organization called Children Not Number, that is doing amazing work with healthcare to children and evacuating children from Gaza in urgent cases. We finally got her out, but then her mother didn't get the permit. Still a breastfed baby, she had to go with her father, who is also the liver donor. And she's still in Egypt, almost 2-year-old now. So most of her life she's lived without her mother next to her. At least she was saved and she's better. But that just shows the tragedy of this issue. Just diverting the look back into Israeli society. So, as I guess many of you know, a genocide doesn't happen unless there's an entire society that is totally recruited and either silent or supportive of atrocious acts. And one example is the medical community, which failed miserably in the past year and a half. I'll try to be short, and we also, there's a paper we wrote that is going to be out soon. I can send it and Hila can circulate it. But starting from silence, so for example, the only statement that the Israeli Medical Association issued, together with the Psychological Association and the Nursing Association, is a letter to the WHO. As you can see, it's November 23, 2023, so it's already after the raid on Shifa, to the director of the WHO, claiming that the WHO has to, discipline, I don't know even how, Hamas for attacking Shifa Hospital. So while Shifa Hospital was attacked and raided by the Israeli military, all these medical associations, healthcare associations, were putting all their energy into attacking the WHO for not reprimanding Hamas for attacking Shifa. And that is just one example of the silence that we've seen in the past year and a half. We're trying to get the Pediatric Association to talk about kids in Gaza, to get doctors in Israel to stand in some solidarity with Gazan doctors who are detained in Israeli facilities, and we're getting very little response. And of course, direct support. This letter that was signed by 80 doctors and called on the Israeli military to bomb Shifa Hospital and other hospitals. The Israeli Medical Association Ethics Committee later said that it's the wrong thing for doctors to say, but nothing happened. There are doctors that we and our community knows. Our chairperson, actually, one of her direct managers is signed on this letter. People who are senior in the system, they have students that they are teaching. That's bad. And also the violations of medical ethics, especially what concerns the detainees, Gazan detainees in Israeli hospitals. So the Minister of Health and also directors of hospitals that are the best hospitals in Israel. It's not like these kind of niche institutions. Hadassah, Sheba was now ranked 8th in the world, the 8th best hospital in the world, and the director refused to admit Gazan detainees to the hospital. And other violations that we're also going to publish a report about that pretty soon. I don't want to be conscious of the time because we are. I should stop, right? So I'll just say that we also have. I'll not get into the details, but what we think, and there's a link also to this statement that was signed by 17 other international organizations, needs to be done in terms of like the healthcare in Gaza now and when aiming to rebuild it with a focus on Palestinian healthcare workers, the healthcare community leading these efforts. And this is very important because we now see all these efforts, the Israeli and American efforts to kind of build other mechanisms that bypass Palestinians and the international humanitarian organizations to create a system that is more kind of easy for them to control. Thank you.